Welcome back. In case you are just joining us, this is still Health Result on KAFTAN Television, and today we have a medical student who is Muinat Immam, who is going to tell us more on sickle cell anemia, the causes and symptoms. Muinat, how are you doing?
I'm very fine, thank you.
It's good to have you join us today.
It's good to be here.
Okay, to begin with, in a layman's term, can you explain to us what sickle cell anemia is?
So, sickle cell anemia is a genetic disorder that is as a result of two people coming together, getting married, and each individual has an abnormality, which is the HBS gene. So, in order for somebody to be categorized as having sickle cell anemia, they must inherit an autosomal recessive gene, which is the HBSS gene. So from there, we can say this person is what? Anemic, is a sickle cell patient. So another way we can also categorize them is by their blood samples. So if you are able to do a peripheral blood film and you see red blood cells being spickled, then you can say, okay, this person is what? A sickle cell patient.
Okay, how is sickle cell anemia diagnosed?
How is it diagnosed?
Yes.
So we can, depending on when the patient is presenting, we can diagnose by doing different tests, different laboratory tests. One of it is a solubility test, another one, sickling test. But the most common one that people are aware of is the hemoglobin electrophoresis. So the electrophoresis, we get to see a band, like maybe on a gel, that tells us that this person has, when you see a double band at the SS level, you know that, okay, this person has what? Sickle cell. Another one you can do is also a peripheral blood film, like I said earlier. You can look under the microscope and you can check if this person's red blood cells are sickled. We know that a person's red blood cell is meant to, more like a donut shape. You get, it's meant to look more like a donut shape. But under the peripheral blood film, you can see something like a C shape, more like a sickling shape. So in that case right now, you can say, okay, this person has your sickle cell. So there are other methods to also do it, but these are the common ones that we have around.
Okay, you can also tell us the other methods that we have too.
Some other methods that we also have, you can do imaging in the sense that you can see sickle cell habitus. Those are more like the symptoms that the person is presenting with. Do you get me? An HBSS patient will most likely come down with different crises. Are you getting me? And those crises, those will lead us to our diagnosis that, okay, why is this person coming into the hospital on a daily basis? Or maybe a complaint of malaria and all that, and you can also see that. Another one is, I think those are the few that I remember right now, but if I remember any other one, I'll let you know.
Okay, what are the causes of sickle cell anemia?
So like I introduced earlier, first of all, people tend to mistake sickle cell diseases with sickle cell anemia. Sickle cell disease is an umbrella. So, sickle cell disease is an umbrella whereby we have a person who has two abnormal genes, two abnormal hemoglobin genes. So, if the person has at least one of them being HBS, we say this person is what? Has sickle cell disease. If the person has both, that means the person has what? Both HBSS, we say this person has sickle cell anemia. Now, how do people get sickle cell? It's purely genetic. It's basically a mutation in beta hemoglobin, position 6 of the genotype. So if anybody is getting married and being checked or is not aware of their HB of their genotype,
Genotype.
they can fall victim. In the sense that, and if somebody that is AS and another AS gets married, there is a high likelihood that they will have 1 in 4 chances that they will have a child with SS. If somebody who is AS and SS get married, there is even a higher likelihood of them having a child with what? SS. But all this is just as a result of a mutation gone wrong. Do you understand? So that's how people get it. You can't say that it is viral or bacterial, it is genetic. So once it's there, it is there.
So that means AS and XS is not advisable to get married.
It's really not advisable. It's really not advisable. I think we're quite enlightened right now, in this 21st century, that people can actually go and get tested and get their genotype done. So it is advisable if you, before getting married, you get your genotype done, you try to know that, okay, this is what I am. Am I AA? Am I SS? So in that kind of situation right now, if you are aware that you are an AS patient, it is we will advise you right from there that you should try as much as possible to make sure that your partner is an AA, so that your children do not suffer the consequences. Because if an AS and AS marries, it is highly rare for you to come out with a child with AA. I'm not saying it doesn't happen, but it is highly rare.
But if it wants to happen, that means it will happen in a miracle way, not medical
Yes.
way. Okay.
Well, it's not. I would say it's not in the medical way. Everything happens miraculously when it comes to pregnancy. But at the end of the day, you would have a more chance of having SS than AA. AA is very, very rare. And once you are able to have AA, then I think at that point we'll counsel you not to have further kids if you want. Like we kind of tell you not to have, so that you don't end up having a child with SS, because the medical conditions that come with it are quite much, and it puts the patients, which is our HBSS patients, in a lot of stress and pain, and we wouldn't want to see that.
So that means it's possible for someone to get married, like if AS married SS, it's possible for them to have a child which is AA.
No, it's not.
So that
AS
means,
and SS.
okay, so that means they cannot have a child who is AA.
No, if you are AS and your partner is SS, there's no miracle that can happen that can make your child AA. The only 2 genotypes that we will most likely be looking at in that case is AS and SS. So those are the 2 that your child can come down with. If you have a child that is AS, then the child has escaped many of the problems that comes with being an SS patient.
Okay, are there different type of sickle cell? If yes, please kindly list them.
Well, there are different types. That's why I said we have something called sickle cell disease. We have sickle cell trait, and then we have sickle cell anemia. So when we are talking about sickle cell anemia, we're trying to tell you that the person has both of the genes for a sickle cell patient. So the person has SS. When we're talking about sickle cell disease, that means the person has one S and other types that are not normal. They are abnormal genes. So you can have HBSC, HBSE, D. You can have ORM. I think, yeah, those are the 5 common ones that are around right now.
So what about sickle cell trait?
So for sickle cell trait, that means you have one normal trait, one normal gene, which is the A, and you have another one, which is the abnormal one, which is the what? The HBS. So that means this person will has the gene, but isn't exhibiting the characteristics that qualifies the person as the HBSS. So they will live a relatively normal life, no crisis, it's very rare. And it's more as if they are living like somebody with AIDS. So that's basically it for sickle cell trait.
So out of all these type of sickle cell, which one is more dangerous?
The one that is more dangerous is the one we're already talking about, which is the sickle cell anemia HBSS. Sickle HBSC, all those ones, they vary. Their presentation varies, and they are much more. I would say that they don't have their own crisis or their own symptoms, but it is just milder than somebody with HBSS, which means that they are completely so yeah, that's what I would say about that.
Okay, what are the symptoms and complications of sickle cell anemia?
Well, for symptoms, we expect that, or we look forward to the fact that when a patient with sickle cell comes in, depending on the age, the symptoms vary. It's wild range. They can come in with, depending on where they are or the age or the severity of the crisis they are coming down with, or the type of crisis even, their symptoms will vary. So for most likely children between the age of maybe 4 months to 6 months, their own symptoms, they are wild range. We can't exactly say that this is a big problem. They can come down with fever or malaria or whatnot, but you realize that most of the time they require a lot of maybe transfusion, right? And when we say something is anemia, that means the PCV is low, which is the packed cell volume. So depending on what is causing the crisis, that's what will lead to the manifestation of the symptom. So we have type of crisis. We have hyper hemolytic crisis. We have vaso-occlusive crisis, sequestration crisis, megaloblastic anemia, several crises that can affect a sickle cell patient. So it depends on what they are presenting and the cause of the presentation.
Thank you very much, Maimuna. We will be right back. Welcome back. There you have the benefit of garden egg, and we are still in the studio with Muinat Immam, and we are still discussing sickle cell anemia. Thank you, Maimuna, for staying with us.
You're welcome.
Okay, to continue our discussion, what are the role of environmental factor in the progress of sickle cell disease?
The environmental factors are quite minimal to how it affects a sickle cell patient. However, lifestyle changes such as being constantly hydrated will actually help with the crisis, such as vaso-occlusive crisis. It will not eliminate it, but reduce the amount of time that we have those crises. Honestly, I really can't say much about environmental factors, because I really don't think they affect them that much. It is more of a genetic disorder rather than an environmental disorder. So,
okay, is there a possibility of the disease developing into other disease, such as kidney disease, lung disease, and so on?
Yes, those are the complications. those are what we call the complications of sickle cell. So, like I said, the red blood cell, they sickle and they start to block the blood vessels. So in doing that, these terminal blood vessels, they become, it's like those terminal blood vessels are dying. They're dying off. So over time, the more they are having this crisis, the more it affects several organs, multiple organs at the same time. It can affect the liver, it can affect the spleen, causing hepatomegaly, splenomegaly, can affect the kidney, causing renal diseases, can affect even the lungs, causing acute chest syndrome. There are so many, the list goes on. The list goes on. It can affect the joints as well, giving them dactylitis. So they will have swollen limbs. Those are what we call sickle cell habitus. So you get to see them as they're having the crisis. And bone pain, priapism, all this are the result of them having the crisis. So all of this can occur. Okay, so it just requires proper treatment.
Okay, all of this can occur, but which organ is most affected when someone has sickle cell anemia? So that once someone has sickle cell anemia, the person will know, okay, definitely this organ will be affected.
You can't say definitely this organ will be affected because so there are multiple organs.
It can just be anywhere in the body.
The thing is, it's not affecting just a part of the body at a time, right? It's affecting the whole system, your blood vessels. There's no part of your body that you don't have a blood vessel. Are you getting me? There's blood vessel every single way. So once the red blood cell go into a sickling state, it affects everywhere in the body. So it depends on how long this person has been having the crisis. That's what we can now say that these are the consequences, or how much the effect of the crisis is. So you can't say that, okay, it's going to only affect the bone today and it won't affect the kidney. You get? So as a doctor, you have to be very cautious, and you have to check every single part to be sure that, okay, what is going on, how is it affecting the patient, and how to treat properly and adequately.
As a genetically inherited disease, are there other genetical diseases that may rise as a result of having sickle cell anemia?
None that I'm aware of. There might be, but there isn't any that I'm aware of right now that is a genetic disease arising from sickle cell.
Okay, coming down to the treatment of anemia, it is believed that universally the treatment of anemia is high. Is there any natural medication that can cure anemia?
In the future, we might find a cure to anemia. But right now, research has it that a definitive solution might be bone marrow transplant, hematological stem cell transplant. All those ones are a definitive solution, but all of these are quite costly. They are really expensive. So for just management to prolong life and to be able to live a normal life just like everybody else, I would just say that proper treatment, which there are a lot of medications that can be placed on. Okay, so there are medications that they can be placed on to enhance their life. There are counseling that will tell you how to prevent the crisis, or when the crisis happens, what should you do. So, but a definitive treatment would be to do an hematological stem cell or a bone marrow transplant. Anyone.
Okay, you said there are a lot of treatment that can be done.
Yes.
What are the treatment and therapy options for a sickle cell anemia patient?
For treatment, like I said, it is symptomatic. So when the person is not in the hospital, right, one of the main causes is when there is hypoxia, when the person has low oxygen saturation. So in that kind of situation right now, you advise this person not to put themselves in that kind of situation, not to do strenuous activities, not to be well hydrated. Those are just normal lifestyle things that they can do to keep themselves healthy and out of harm. To also treat infections on time. Timely, once they notice something that is wrong with them, they should go down to the hospital and get checked for it. Even a slight cut or infection can trigger the sickle cell crisis. If they come to the strong antibiotics to help in treating these patients, they can replace to relieve pain. We can also give them anti-inflammatory drugs to reduce the pain. There are so many treatments that we can do, but firstly, we look at their pain as symptomatical. So it depends on what they are presenting with. That's how we treat.
Okay, the journey therapies for sickle cell patients has been common among people. Can it safely provide an adequate and permanent source of hemoglobin for patients?
Provide a permanent source in what way? In what form? Is it like blood transfusion?
Yes, well, the blood transfusion.
That is not really advisable. That's not advisable. Like, yes, if there is a need to transfuse a patient, you should definitely go ahead and transfuse. However, that means that you ensure that all other alternatives have been ruled out, and the last result is what? Transfusion. However, the definitive, like I said, the definitive solution that you can say, okay, this person is not going to come down with any more crisis, any more problems, is if they do a bone marrow transplant. So in that kind of situation, that means that the bone marrow is going to be supplying, and it's going to be a bone marrow transplant from somebody that is most likely to be AA, so that the new red blood cells that are being produced will not carry an SS hemoglobin. They will be carrying AA. So at the end of the day, the person will be very much stable and will be able to live a healthy life. But for right now, in Nigeria, it's mostly supportive, but there are places that can do a bone marrow transplant. So that's the definitive solution.
And what advice do you have for people living with sickle cell anemia?
For people with sickle cell anemia, I would like to tell them that it's not the end of the world, honestly. And they shouldn't give up, because there are so many things you can still do with your life, even with the crisis and with the social part of everything. You can also still live a normal life. Just ensure that you take your medications, you go for annual, like, proper checkups. Whenever something is noticed or you feel one kind, don't self-medicate. Go ahead, go to the hospital, get checked. If there's a need for transfusion, or even if you can get a bone marrow transplant, you can definitely talk to your health providers about it, and they'll give you a proper and reliable solution. So there isn't really much. They are humans, just like everybody else, so they can definitely live a normal life.
Thank you very much, Maimuna. It's good to have you join us today.
Thank you so much. I really appreciate it.
I hope you join us next time too.
No problem.
Thank you very much. And living with sickle cell is not the end of the world. If you want to get married, ensure you go for your genotype test. Ensure you know what your partner genotype is in order to avoid a situation like sickle cell. And mind you, sickle cell is not the end of the world. Like I said earlier, if you have sickle cell, go for a checkup regularly, take your treatment. And that will be all on today's episode of Health is Wealth. See you again next time. I am Yetunde Alanamu.
Yes, there is news on your device, but hearing an analyst's perspective is the icing on the cake that Daily Break Africa provides. Break. I mean, start your day with prompt analysis of the latest news, trends,
exactly, and then you see these people, they are so agile, they can do a lot of
politics.
We have to go back to that regional system. That is the foundation of this country, for God's sake.
Entertainment, fashion, culinary skills.
So first I'm going to be pouring the oil inside because
religious and cultural events amongst others on Daybreak Africa.
For a rich mix of analysis on current issues, tune in daily from 7 a.m. to 9 a.m. on channel 480 and 124 on Startimes.